Mr. Null, if you'd like to pull that mic up and hit the light, we'd like to take your opening statement. Again, a longer one will be submitted for the record, but if you would, please.
Okay.
Look forward to your testimony.
All right. Thank you. Good afternoon, Chairman Stupak. We appreciate the invitation here. It's quite an honor, and we thank the entire subcommittee for taking the time to hear our story. Our story actually begins in 1999 when I became self-employed. We had a company. We employed 12 people. We had group insurance, and then 9/11 hit. And like many Americans, that time hit us very difficult. Within about 6 months, we had to drop our company-sponsored insurance, and I had to enter into the world of individual insurance. January of 2005, we'd been without insurance for about 3 months. We had a short lapse and a quick trip to the ER for an $800 liquid bandage for my daughter's chin was a costly but excellent reminder of the value of insurance, and so we began looking for a policy. Sherry and I spoke at length to an insurance agent at our dining room table. I explained I don't mind paying for the hospital or the doctor's visits. It's the big catastrophic hospital visits that we need. I told him, quote unquote, I need coverage for the big oh no. And he looked at me in the eye and told me that I'm a very savvy shopper and that this was the policy for us. By the time he said that we factor in our negotiated rates and what the policy pays out, you'll hardly have to pay anything, the way he explained it. We felt like we were getting what we asked for, and we were relieved to be protected again. 3 months later, Tatum was 7. It was the first night of our family vacation, and Tatum's touch of stomach flu seemed to worsen, so we headed home. Hours later, she slipped into a coma. Before the sun set the next day, we were told she would require a liver transplant within days to save her life, if they could keep her alive that long. While Tatum was clinging to life in the ICU, the transplant department administrator came to me and he said, we need to talk about insurance. And he walked me to a council room. As we walked, I thought to myself, I wonder what he wants to talk about. Aren't I glad that we picked up this policy when we did? We reached the council room and he proceeded to explain that my insurance had capped out at $25,000. That was basically the night before. From that point forward, Tatum no longer had any sort of insurance, and it was hospital policy to collect a $200,000 deposit for them to proceed with the liver transplant. I honestly couldn't believe this was happening. Could this be true? Surely it's a mistake, because this is the big oh no that I was buying protection from. Suddenly, not only were we facing the possible death of our child, but now the financial death of our family. How could this be happening to us? We have insurance for this. A donor was located, and Tatum received her transplant with probably less than 48 hours to live. Once she stabilized, the hospital helped me apply for Medicaid, and we were narrowly approved. The coverage was retroactive, and they covered the entire transplant, well over $500,000. Our so-called hospitalization policy covered less than 1/10 of that cost. Even with insurance, we were left with a balance we could never bear to pay back. Tatum and our finances both had near-death experiences, and although we didn't know at the time what going on Medicaid was going to mean to our family, we were grateful for it. But our daughter had been on life support for a week, and now our finances were going to be going on life support for the next 2 years. Post-transplant is very medically expensive. We never knew what each day would bring, but we knew we couldn't afford even 1 day without insurance. We began to look for insurance that would help cover post-transplant expenses so we could get off of Medicaid. Then I was told by insurance agents to not waste the time, paper, or ink filling out the applications with Tatum's name on it, because they would refuse to even accept it. We now had nowhere to turn, and we were somehow now stuck on Medicaid. It was simply that the insurance industry would not make a policy available to us in the individual market. So in order to keep receiving health care for Tatum, we had to voluntarily drop our income to near poverty to satisfy the Medicaid requirements. The allowed monthly income on Medicaid was a shocking $1,613 for a family of 4. This barely allowed us to cover our mortgage, most utilities, and some of our food bills. This meant that I'd frequently have to pass on work, and it was even suggested that maybe Sherry and I should get a divorce for financial reasons. These were tough times when we found ourselves in the red every month. Interestingly, though, with Medicaid, we never incurred any cost for health care. We actually owe nothing due to medical debt at this time. The cost of staying on Medicaid is on the backside, trying to survive on $20,000 a year. We took tremendous debt on, eliminated our savings in retirement, and put our growth on hold trying to survive while she got the health care that she needed. After 2 years, she began to reclaim her new life. There were now more good days and bad days, and so her mother returned to teaching, group health coverage, and an entirely different insurance experience. I found it interesting when we transitioned to group coverage, Tatum was accepted without open arms and without question. It would appear as though individual policies and group policies exist in completely different universes. Her mother and I are thankful for Tatum's physical recovery is quicker than our finances. She's growing, thriving, and giving back. She regularly appears on behalf of Children's Medical Center, the Southwest Transplant Alliance, and her favorite charity, Make-A-Wish. Her life has been a joy and an inspiration to many. We'd do it all again for her sake, and we're thankful Medicaid was there for us. We're equally thankful to be off of Medicaid. We do hope our testimony illustrates how hospitalization policy in question today was obviously worthless. We've learned that the languages of policies can be confusing. In spite of both being college educated, we didn't understand at the time the $25,000 maximum for miscellaneous hospital expenses basically meant all the hospital expenses. Even today, we find the wording still a little bit counterintuitive and misleading. But I asked for, in very clear language, I thought, a policy that would protect us from the big O no, and we ended up with a policy that would do no such thing. While our testimony should be labeled grossly underinsured, we've since learned that even traditional million-dollar policies, which would seem like a safe bet, are no challenge for long-term life-threatening illnesses. I got the call on Tuesday that the hospital had added up Tatum's cost at Children's Medical Center, and as of right now, her cost is $1,284,335, and that does not include any of the doctor's bills. They're billed separately. But most importantly, we've learned that being underinsured really is the same as being uninsured. They both lead to the same end. Underinsurance certainly impacted our lives. God carried us through, and we trust that He will continue to do so, and we're glad. We've learned from this experience, and we're trying to move on. It seemed like the story ends here, but it's actually just the beginning for Tatum, as you already know. Underinsurance probably isn't the biggest tragedy of our story, if you ask me. Her story encompasses other shortcomings that you need to do something about. What continues to sadden her mother and I is this issue of blacklisting because of her pre-existing. Tatum's going to grow up, and one of these days she's going to need insurance. And, we're lucky because Sherry's dream has always been to teach, and that gives us access to group coverage and the benefits that come with that. But that may not necessarily be everybody's dream, and I don't think that's really fair, and I don't really think that that's American. I ask you to consider this. When Tatum was just 4, she went to New York City and stood transfixed on Lady Liberty. They told her then that Lady Liberty stands and invites the world to come to the land of opportunity where anyone can follow their dreams. And yet Tatum, a born and bred American citizen, might not be able to share in this dream through no fault of her own, simply because the insurance industry has developed a system that won't allow it. Our Tatum has so much potential, but for now she doesn't have full access to Lady Liberty's promise. She can't pursue little girl dreams to be an artist or have a dress shop, a restaurant, or self-employed in any fashion that requires individual coverage. When she asks me what she should be when she grows up, I can't tell her the same thing that you probably tell your kids. I can't tell her she can be anything she wants, and you guys need to fix that for me. Do I tell her that the government before her today, a government for the people, by the people, refuses to take the steps to also protect her rights to life, liberty, and the pursuit of happiness? What do we tell her? In closing, while my purpose today is to testify and answer your questions as an American citizen, I also come to pose just one question to the very distinguished committee as a father. Which of you will commit yourself today to be able to look Tatum in the eyes and tell her that you will be helping lead the way, and you will see to it that when she grows up, she'll have affordable access to adequate health care, regardless of her occupation, and that today she too can start pursuing all of her American dreams? We sincerely pray that God bless you and guide you, and God bless America. Thank you, and please be an organ donor.
Thank you. Mr. Wilkes, your testimony, please.